Step one, create space, desensitize to get you moving. So we're going to do some self-massage that you can do at home, but absolutely go visit your local therapist and get some hands-on work. It can help reduce the pain and make moving easier so that you can start loading. Now, a couple of things to note. We're going to use a ball. It can be a tennis ball, a massage ball, whatever you have available to you. We're actually going to work against a wall because that will give you greater levels of control. Also, often if you do ball rolling for your back on the ground, you go from already having increased curvature in the lumbar spine to putting a ball between that and the floor and increasing that. So it doesn't really go hand in hand with our goal. Whereas against a wall, instantly, to keep the ball against the wall, you're going to engage the pelvis. So it's helping in terms of engagement and strengthening the back too. We're going to work not only the lower back, but into the hips, as often the hips and lower back go hand in hand when there's back pain going on. Now, we're going to do two different types of techniques. One, general massage, just loosening everything up, exploring the back and getting it to feel better. And two, we're going to do trigger pointing. And this is where we find those tender spots. Press and hold and just breathe. And what we're expecting to happen is that the pain will start to fade. That can take 30 seconds, 40 seconds, a minute. So be patient and breathe. And what you'll find is that pain can go from a 7, 8 out of 10 right down to 1, 2, or gone completely. If, however, when you're holding those trigger points, it gets more painful after 10 to 15 seconds, this is indicative of more acute injury. So come off, you're not ready for the massage ball yet. Right, take your tennis ball or your massage ball and we're going to focus on releasing three key areas. One, the erector spinae, so those tubular muscles each side of the spine, so to create space and length. Two, the quadratus lumborum, so coming into that lower side back area. And then we're also going to work the hip and the back of the pelvis. Too often our hips become really tight when we've lower back pain, or sometimes that lack of mobility in the hips can drive overuse and pain in the lower back. So you're going to take your tennis ball, your massage ball, and we're going to find the back of the pelvis and come up onto the soft tissue on that right side of your lower back. Now, we're just exploring. So by pushing the ball against the wall, I can control the movement. So up and down, side to side. Where does it feel more tense? Where does it feel more sensitive? Right, I found a tender spot here. So if you find a tender spot, we're going to push gently against the wall. And just breathe slowly and just try to relax. So what you should find is that after 20, 30 seconds, that pain, that tension might start to reduce. This can take anywhere up to a minute. But remember, if it's getting more painful, come off. That means you're not quite ready for the massage yet. Once that pain fades, move slowly. Because what you'll find is if there's one trigger point, they tend to gather and satellite near each other. Find that next tender spot, push, hold, and just simply breathe. Now, also remember to explore into that side of the lower back. So here I'm just adding a little rotation. Finding again where it's tender and where it's tight. Also notice your pelvic position here. Don't stick your bum out, which will make it hard to hold the ball. Tuck your tailbone under, keep that core engaged and push in. Now find the tender spots again and hold. And once that pain fades, it can be quite nice to add some movement. So here I'm just trying to take those ribs away from the pelvis. So creating a stimulus and a stretch into that lumbar area. Take your time with this. You could spend 10 to 15 minutes depending on how much tension, how much pain you have. Now, remember to do both sides. So you can simply roll it over to the other side, but when you're crossing the spine, don't press into the bone. Just come up off the pressure and move the ball to the left side. And then you're going to repeat that exploration, that general massage, which feels great. Stimulating the area, creating some movement in those connective tissues of the lower back. Find where you need the work and just press, hold, and breathe. Again, add some movement. Yeah, that could just be some like hip hinching, some side bending, some cat-cow type mobility stuff. Movement is great. If it feels good, do it. Okay, so you're going to work right and left, and remember into that left side, side back as well. So adding movement, but also where it's tender, simply pressing and holding until the pain fades. Now, let's also work that connective tissue that comes down into the back of the pelvis and into the hips. So we're going to move from this above pelvis position down to the pelvis, the sacrum, and just loosen up all of this connective tissue before we move into the hip muscles themselves. So again, you're taking the ball back of the pelvis, and we're just going to do some general massage. So you've got your SI joints or sacroiliac joints at the back of the pelvis, as well as that connective tissue that's come down from the lower back. So this can be quite a sensitive area, but also an area that feels great with some gentle massage. So here I'm just going side to side. Remember, we want this to be a 3, 4 out of 10. We don't want it to be painful in 8, 9, 10. So you're in control of how much pressure you're applying. And that's the beauty of working against the wall. Now, find a tender spot, press, hold, and breathe. Same principles, just different part of the tissue. And you're going to repeat that all around the back of the pelvis. And then we'll move into the hip. So coming off the bony area into the soft tissue. Now, working against the ball for the hip is so good. You can work into those layers of the glutes, the attachments on the pelvis right down to the head of the femur, and you can even rotate and get into some of those abductors. So this feels really great. Just some slow, gentle massage. So I'm doing some circular movements, some side to side movements, just exploring. And as you do this, you might find that you can start to gradually add a bit more pressure, slow it down, and really get deeper into those layers. Now, I have found where I need the work, and that's deep to those glutes, so into those hip rotators. And I'm simply going to push and hold. And we're waiting for two things. One, the pain to fade, but two, you'll sometimes just get this sudden release. So where the muscle's quite tense, suddenly you'll just feel it let go. And then move to the next tender spot or tight spot. Press and hold. Now, if you get any tingling or numbness down the leg, come off. You're probably pushing into the sciatic nerve rather than into the soft tissues. It's not an issue. Simply move off that part of the tissue and the tingling will stop, and stay in that soft tissue that we're looking for. Press and hold. Again, feel free to add movement, some tilting, pelvic, anterior, posterior. Movement feels fantastic. Some side to side, so getting this hip movement, side to side, feels really great. And just remember, there are no rules other than don't create pain. If pain increases, get out, and any nervy feelings, get out. Other than that, explore. Find where you're holding tension and let it go.